I'm Elise, and this is Annabelle. We are from the University of South Carolina School of Medicine, and today we're presenting about a self-led student group that was started last year that is focused on telehealth management of diabetes in our local area. So basically, this project started off with basically identifying our zip code and specifically South Carolina, with diabetes being as one of the top leading causes of death, and then amputation rates being as one of the leading cause and problems in our area with diabetes specifically. So diabetes, obviously, as we all know, has a lot of severe complications. And our goal was to basically develop a medical student-led model where we can serve these underserved patients in South Carolina to help manage their diabetes through a telehealth method. And that involved basically pairing up with a free medical clinic in our area, which we enroll patients that basically come in and they have uncontrolled blood sugars, or they're not compliant with their medications, or they're unsure on certain ways to manage their health. And we enroll them in our program. Usually we'll have an A1C greater than 7%, and we'll enroll them in our program and pair them with a medical student that is volunteered in our program that will call them bi-weekly every 2 weeks and basically work with them to set goals related to focusing on their diet, exercise, sleep, hydration, anything really that can help in talking about what they need to manage. And this is a huge goal for us because these providers at the med clinic, they don't have that much time to talk with the patients about all their problems. So this allows people like us, the medical students, to kind of manage that with them.
So like Elise said, we wanted to address the barriers that these patients were facing. And we felt that one of the best ways to do that was to call these patients while they were at home, actually facing these barriers instead of when they were at the clinics and perhaps they had forgotten about some of these barriers. And so what we found was that the main barrier the patients identified were food insecurity, lack of transportation, along with other different types of barriers such as mental health, disability or ability to exercise, financial insecurity, trouble sleeping, and housing security. And then something we also wanted to focus on besides these barriers was making sure that these patients felt more confident in managing their diabetes once this project was done. So it's a 6-month-long project where we call these patients bi-monthly. And so we wanted to make sure at the end of this 6 months that these patients would end and be able to manage their diabetes confidently and continue hopefully improving their A1C levels. And so what we found, like I mentioned, was that the food insecurity and lack of transportation were some of the biggest barriers. And so we focused on improving food insecurity through referring these patients to VeggieRx, which is a program through Food Share. And so the patients are able to get fresh vegetable boxes so that they're able to cook these meals at home, along with having a food truck come to the free clinic in the future to help show these patients that healthy food can taste good and show them how to cook some of these food items. And we're also working with the transportation issue. We worked with the free clinic to set up being able to schedule appointments. Prior to this project, the patients were not able to schedule appointments. And so they'd have to go early in the morning and sit there all day. And so they weren't sure when they would need transportation and how long they would be there. And so we've worked to have our volunteers call these patients 2 weeks prior to their scheduled appointments. So that way we can work with them to find a way to get them to the clinic. And then we also are training our volunteers to tell these patients about the bus system and, ways that they're able to use that so that they can get to the clinic. And so what we found in the first year of this project is that we've had an average change in A1C over 3 months of 1.47. So we've had 9 patients that have completed a 3-month A1C follow-up. And then we've also had 5 patients complete a 6-month A1C follow-up and have found that we've had a change of 0.74.
And since this has been such a great improvement in just our limited kind of rough draft of this year, we're going in future directions. We recently got backing by the South Carolina Physicians Association with a $30,000 grant to basically supply these A1Cs to the clinic. And we're also working with clinicians at the School of Medicine. We have 2 faculty on board and a statistician PhD who are helping us kind of improve this project as we go. The biggest thing is we've also expanded from our free clinic here in Columbia to other clinics in the South Carolina area, which will help us with our overall goal of improving diabetic health in South Carolina.